good afternoon and good evening all at the same time. Greetings. We're happy to have you here tonight. I'm Fred Litton, the Dean of the School of Education and Human Development here at UHV. And we thank you for coming out this night. So welcome to our spring symposium, which is going to be on autism. I think you're going to enjoy it and hopefully learn a little bit in the process. But before we get started, let me introduce to you our provost, Dr. Jeffrey Cass, who might just want to come and welcome the group to the campus.
Okay. Well, welcome. I apologize for the, I'm sorry the president could not be here. You know, new dads have issues with babies. And so I'm afraid he was taken to that direction. But on behalf of University of Houston Victoria Administration, welcome to this wonderful event. Events like this, I think, speak to the fact that we are creating a campus culture and a culture for the community that values intellectual interaction. And I think that this is just, I hope, one of many future events for the university and specifically for the School of Education. So I welcome you here tonight and thank you for taking your time to come. I would like to say that in our new building that we're looking at, which is a couple of years off, we'll have a new auditorium for 250 people. And I managed to convince people with a bit of arm twisting to put a stage in that room so we can have all kinds of events in that room. So that's the future, but we're so glad for the present too, and thank you very much for coming and gracing us with your knowledge, because this is a subject about which I know absolutely nothing. So I really appreciate the fact that I'll be enlightened so that when Dr. Litton presents the new figures for our concentration in autism, I will have some general understanding of what he's talking about. So thank you very much for coming, and thank you, Dr. Litton, for hosting.
Thank you for being here. Well, as you know, April is National Autism Awareness Month, and we have missed it by a couple of days. I tried to get our speakers here for the month of April, but they were so tied up. In fact, the entire spring semester, this was the first available time that they had to come to be with us. So it is May the 2nd. And in doing a little reading the other night, I discovered that May the 2nd is World Autism Awareness Day. So I would like to say I planned it that way, but I'm just not that smart. It just, out of 365 days, it happened to be the day that they selected to be here. So they told me earlier to announce that they were here because of this day. I said, well, I can't do that. I won't do that. But anyway, autism is a fascinating topic. I'm teaching this semester a course, and in the book, it's dated 2010, and for the autism chapter, it says that the incidence is 1 out of 150 births or kids will be autistic. In 2011, it changed to 1 in 110, and today, the Center for Disease Control, it's 1 out of 88. So something is occurring, and I really think we're in the infancy of knowledge about this topic, but we're fortunate enough to have two experts with us tonight. And so let me not take any more time, but introduce them. But I wanted to make you aware of two of their books that they just published. Dr. Wahlberg on Finding the Gray, Everything is Not Black and White, but it's an excellent book. It's a bestseller. And then Dr. Wahlberg and Rotatori did one together on autism spectrum disorders, and I'll have those available if anybody wants to look at it. But anyway, the School of Education has 2 symposiums a year. This is our spring one. And we're in conjunction with tonight we're announcing that at UHV, we now have a Master of Education degree in special education with a concentration in autism. And we've been working on that all year, and we did it without a great deal of money. It doesn't mean that we won't be coming back for some, but we were able to...
Of that, I'm sure.
We were able to institute autism spectrum disorder courses, and we have 5 new courses. So I'm announcing that we have this program tonight. You don't have to enroll in the master's degree program, but you can come in and take those courses and you will receive a certificate of completion from us for doing that. So you're hearing about this for the very first time. I saw a brochure the other day that came across my desk, and it announced a special ed degree with a concentration in autism, and I looked at it. You know how many courses they had on autism? 1. Okay, just remember, we've got 5, and we're excited about it, and they're all online. You don't have to leave the job to take it. Our 2 speakers tonight, it's my delight to have known them for a number of years. Dr. Rotatori is going to speak first, and he's a specialist on assessment practices, and he's kept up with it. In fact, both of our speakers are not only knowledgeable about research and what's happened in the field, but they're actually practicing professionals, and they work with kids and parents on a daily basis. And so they're well-grounded and rooted in the topic. I had to do some figuring, but Dr. Rotatori and I go back 30 years. We've been publishing and writing and presenting together for that many years. And I didn't know if you remember that, Tony. It's been quite a while. And Dr. Wahlberg, he and I go back 16 years, and the 3 of us, 16 years ago, presented a lecture on autism in New York City. And I don't know if you remember this, I didn't get a chance to talk to him about it, but we were there in a small room, and people kept coming in, and people kept coming in, and they kept coming in. And finally they said, we're moving rooms. And so they moved us out of that room into the ballroom of the New York Hilton Hotel. And it held several hundred people, and it was full. So anyway, we go back that many years. So it's my delight to have both of them here tonight, and I will not take up any more time, but Dr. Rotatori, if you want to come and speak first.
Thank you. Let me just introduce Dr. Wahlberg and myself. Actually, our interest in autism stemmed from a little difficulty we were having when we had our clinic, and Dr. Wahlberg was a graduate student in our counseling clinic, and we had a young fellow who was a college student, and he came to the university and wanted to have some help with some of his adjustment aspects. And up until that point, in terms of autism, this was the early 1990s, up to that point, most of the work on autism was with children or adults who were cognitively impaired. At that time, about 75% of individuals with autism had cognitive impairments. And it wasn't until about 1987 that Dr. Lobos at the University of UCLA began doing some work in terms of what now is pretty popular, applied behavioral analysis, and working with these children to change their social skills and teach them academics and so forth. And so that interest in what we sometimes refer to as high-functioning autism or Asperger's really began to come to light. Well, when me and Tim finished the first session, Tim was leading it, and I was watching from the one-way mirror, and we sat down, and I said to Tim, what is he thinking? What is this fellow thinking? And so that was the start. We started to look at, how does an individual with autism think? Why did they think that way? Because it really threw us in terms of approaches and so forth. And so since that point on, Dr. Wahlberg has worked with individuals with autism, and an excellent clinician, has a wonderful intervention program that he's going to talk about. And we've published books in articles. What I want to talk about is how dramatically this area has changed in terms of diagnosis. Whenever we have a new area in special education, there's always a lot of new assessment devices that come out. And so what needs to be done really is, why do these assessment devices, which ones to use and so forth. So, I'm going to get into that in a few minutes, but that is really what we're starting to see now in terms of assessment. There are two particular devices that I'm going to spend a little more time on, because they are considered the gold standards and so forth. But one of the problems we have is that there aren't professionals out there that can always identify who these children are. But there's been so much coverage and research and interventions and so forth, clinics and hospitals doing work, that we've seen a dramatic increase. And while a few years ago, as Dr. Wilson said, it's 150, the Center for Disease Control says 1 in 88. That is more than 1% of the population of children born. And so, is it just that it's grown, or are we getting better at a variety of things? And so one of the things I think we're getting better at is assessment and diagnosis. So, we're going to look at a few of these things. And 10 years ago, it usually wasn't until school age that we started to identify these children. And I'm speaking more about the children with high functioning, children with Asperger's, high functioning autism. Those children with cognitive impairments, as you can see, usually are identified much earlier, because they're significantly delayed in some way. But now we're looking at diagnosis in terms of preschool children. So that's quite a dramatic change in terms of how we approach this. Another thing that has been a challenge, I think, in assessment is that it's those children who do not have cognitive impairments. They are the more difficult group to identify with because they're deceiving. Again, the mentality, when looked at was, something is wrong there. They're delayed in terms of language and so forth. They are engaging maybe in some unusual behaviors and so forth. But it's these higher functioning ones that tend to present more of a challenge in terms of diagnosis. And I think you can see from the figure that, we have some different ages in terms of when these children are identified. Those that are what I consider the most high functioning are children with Asperger's. It's usually not until about 7 years of age. Usually these children are not only average intelligence, many times above average intelligence. Many times these children with Asperger's have normal language development and early language development. So you can see where our thought about, autism is something wrong language-wise doesn't really hold for those types of children. And then we have another category which we refer to as pervasive developmental disorders, which is sort of, they have most of the characteristics of autism, but usually, again, they don't typically have intellectual deficits. But there are other things that sort of delay the diagnosis, and in certain parts of communities, big cities, small cities, rural areas, I think we can see why the problem might be more problematic in terms of delay. Some of them are, for instance, in the rural area. Another one is that there's a correlation between the diagnosis of ASD and in terms of poverty. Children with hearing impaired are often not identified because one is thinking the delay or the deficits may be related to the hearing impairment itself. Many of these children are sensitive in a variety of ways. It could be to sound, to touch. But if they present and they seem to be oversensitive to pain, that's what the medical profession is going to be looking at, not the fact that it might be a characteristic of their autism in terms of treatment. And the other one is that many times these children, because of the variety of aspects that they have, go to more than one health provider. So they may go to 4 or 5 or 6 health providers before they're actually diagnosed. In terms of diagnosed, I want to give you an idea of how difficult it is, and when we started in the 1990s, how we had to approach this. I want you to think of an umbrella. And I want you to think of the umbrella as open, and the umbrella, of course, has spokes. And I want you to think of ASD as a spectrum that involves a number of areas. And the areas in terms of the deficits, maybe language, behavioral, social, intellectual, and the children range from severe, profound, to mild. So we have this umbrella with these variety of things. And then I want you to think of those spokes as being subcategories of other disorders that they might have. Some of them are obsessive compulsive. Some of them are depressed. Some of them anxiety disorders. Some of them have stereotypic behaviors. Some of them have tic disorders. And so when you see this umbrella and you see these spokes, which one do you attend to first? And that has always been the dilemma. So a lot of the times the higher functioning children are not typically identified as being high functioning autistic individuals or Asperger's because we're treating the other disorders. Who does the diagnosis, and where do we usually identify these children with? Well, the biggest group is with hospitals, clinics, and private practices. We have a lot of university centers that specialize in terms of autistic diagnosis and so forth. The clinicians, because there's such an increase in terms of the number, are diagnosing more and so forth, and we have specialized clinics. One of the specialized clinics in Illinois is one run by Dr. Wahlberg. Dr. Wahlberg started the Prairie Clinic, which specializes in the diagnosis and treatment of ASD individuals. Very unique. 1/3 of all children that are diagnosed are by psychologists with doctorate degrees. Why is that important? Well, it's important because psychology departments have recognized the importance of this, that it's an increasing clinical population, and they're spending more time with the students in terms of diagnosing these children and teaching them assessment devices and so forth. About 25% are by individuals that are neurologists or have developmental background in terms of early childhood education. Only 12% are psychiatrists, but that makes sense because the children may not go to a psychiatrist until they need medication for, again, anxiety, depression, obsessive compulsion, or attention deficit. So it might be a little later before they're actually seen by psychiatrists, which means probably someone else has already identified them as such. Doctors of education, about 10%. And we still have the problem of physicians saying, well, let's wait and see. You know, I've been in special education with Dr. Litton since the 1970s, and we're still hearing that. Maybe they'll outgrow it. Well, they don't outgrow it. It's a lifelong disability, and they're not gonna outgrow that. There are certain strategies that are typically used in terms of diagnosing individuals with ASD. One is there has to be some type of interview with the parents, because we're looking at the information of early childhood to identify some of the characteristics that first appear usually before the age of 3. So we have to have an interview. Usually it's also involves some type of observation, observing individuals and children, their behaviors, again looking for those characteristics and so forth. So those tend to be the 2 main ways to work with the diagnosis. And fortunately, we have 2 very good diagnostic inventories, the Autism Diagnostic Inventory Revised, as well as an observational system called the ADOS, Autism Diagnostic Observation System. The one is very comprehensive in terms of looking at those characteristics in those different areas, behavior, social language, repetitive behaviors and so forth, cognitive domains and so forth. And the other one is actually looking at a setup situation in which we put the child into a situation, and the child has to react to the situation. And so it's an observation, but it's a structured clinical observation, and the observation actually helps us identify those specific characteristics. So I'm going to talk about 2 of those because We have gotten more information related to, well, again, we're going to be talking about the Autism Diagnostic Inventory and the ADOS. So one of the things that are sort of challenging is that when we have children who are cognitively delayed considerably, say profound and severe cognitive impairment, it's still difficult for us to identify those. The ADOS does a little better job with that because they have what we refer to as modules, and they have a module for very low functioning children. The ADI, the inventory one, doesn't do well with those children that are more problematic in terms of their cognitive development. And so a strategy has been, and people have looked at, which is better, what should we do? Should we depend on clinical diagnosis? Should we give these instruments and so forth? And what the literature has shown is that actually the ADI and the ADOS tend to over-identify diagnosis and compared to clinical decisions and diagnosis. So that's important. And so why might that be? Well, what one tries to do is look at cases, and both of these do a pretty good job in terms of being sensitive to looking at the characteristics and so forth. They're also pretty good at identifying those children that are not at risk. But again, once we get into that population that are lower functioning, it's more challenging for us. And so we still have a difficulty working with those individuals. Let's get a few here. So in terms of a strategy, what we need to do is probably use both, because we know that when we do a clinical diagnosis, the clinician is doing observations, and the clinician is also doing some type of inventory. So what is really the best way to go is to do both. Okay, we use both in terms of that information, and let me get back to this one. So, the idea is to use both of them. How do we get information from parents? Well, one of the difficulties is that when we get information from parents, sometimes they know about the characteristics, and when they know about the characteristics, they might mislead us, okay? And so some people have looked at the idea of doing videotapes or reviewing home tapes of parents take their children. And there's a number of advantages to this. One is that we actually see the behavior at different stages, 6 months, 12 months, 18 months, a year. Two, that sometimes parents don't always recognize the characteristics that might lead to a diagnosis. Sometimes parents may mislead us, okay? Sometimes parents want to have their children identified so they get special education services and so forth. So we actually have a system of using home videos in which we can actually verify some of that information. And we also can see how the behavior may change over a period of time. Because I'm going to talk about one concept, and that is autism regression, in which we have these children growing normally for 12, 15 months, and all of a sudden they regress. Home movies become an excellent source for working with those children. It's a very small percentage of children that have that type of situation. The disadvantages, of course, are that home movies don't typically see eye contact, and one of the characteristics of children with autism is they don't establish eye contact. And the other one is that most parents are not going to videotape their children when they're involved in a meltdown with their children. Okay, they don't have time to do the videotaping, and so we don't really see some of those problematic behaviors. So there has been some research actually done to look at the value of the home movies and so forth, by a fellow by Palermo. And these are some of the findings. First of all, I looked at children at 1 year of age. And, some of the common things that we see sometimes in the pediatrician's office in terms of the children are not responsive to their names. And they tend to look at people less often. They might look at an object a lot, but they tend not to look at people. At 2 years of age, we begin to see some of these that they don't point. Okay, it's a very common type of thing that the pediatrician will do. Ask the child to point to something. They have less words because typically language development is delayed. And they have what we refer to as repetitive type of behaviors. They repeat things in terms of hand movements and so forth. And we don't typically see those in children that are 2 years of age or longer. And they usually have sometimes unusual posture. They have more inspection of objects, less varied and less flexible play activities, arm waving, and a characteristic that you only typically see with individuals with ADOS. Why is that? They tend to be oversensitive to sounds, and sounds make them anxious. And so we see this not only in young children, teenagers, as well as adults. They just put up their hands. It's a very characteristic form of identification. Let me talk about that autistic regression, because I think this is becoming more important. And again, it's because we're getting more specific in terms of diagnosis and so forth, that we need to identify these children, because sometimes parents say, there wasn't a problem early on. They seem to be developing normally. They seem to be, the speech was going fairly well. All of a sudden, they start to regress. And so this is sort of a special case of autism, because it typically starts later, and they begin to have declines in their capabilities. They're babbling less, their word usage decreases, they don't gaze and look at things as much. And they also, from the studies that they've done, indicate these children prior to 12 months of age tend to have sleep problems, and they are overly sensitive to sensory stimulation. Now, we can't use home movies and videotapes as a way of saying that the child has autism. But it's an assist for us. It helps us look at some of those behaviors, the course of behaviors, and look back. So, we're not saying that this is the type of thing that is essential, but it's valuable because most people take home movies and so forth. Another thing that has sort of changed over the years is that, services for children with ASD didn't occur until the 1990s with special education law. Well, what about those children who went through school, were never identified? They are now adults. And so, if they were never identified, a lot of those spokes are still there. They get depressed, they get anxious, or obsessive compulsive. Okay. And what happens to one of those adult individuals that goes to a psychologist or a social worker or a counselor, and the psychologist or social worker is looking at the characteristics and may not realize that the individual may have not been identified. So there was a study done that actually looked at an analysis of the MMPI, which is a personality scale and so forth, and to see how adults with ASD differed in some way from other clients who had, say, anxiety, depression, and so forth. And the findings are sort of important. One is that the profiles were actually considered to be valid, so that was important. In other words, we can use the MMPI to look at some of those types of behaviors for diagnosis. Another one is, and I think Dr. Wahlberg and myself have found this to be true a lot of times, is that they tend to get a better impression of themselves. There's actually what we refer to as a lie scale on the scales. In other words, they tend to exaggerate their capability. Why do they do that? More capable, more function. A lot of their experiences are negative. They don't get a lot of social recognition, And so when they come to the clinician's office, they try to make themselves appear much better. Maybe Dr. Wahlberg can tell you about some of his clients that have done this in the past. But what's more important is the pattern of responding on the NFPI. And this is what we see. We see that they have higher scores on depression and social introversion, which goes along with the social deficits, that they are just socially discomfortable with individuals, they don't like to be with people and so forth, that they have higher scores on repression and anxiety. But more positively, and something that maybe we don't see enough of, is that they're not as problematic in some areas as other populations. One is that they usually do not have alcohol problems, they usually do not have addiction problems, and they usually do not engage in aggressive behavior. Unfortunately, sometimes what we see in the media, especially when we, killings in Connecticut with labeling the individual as Asperger's and shooting folks and so forth, people get the impression that children or adults with ASD are aggressive, but they're not. Only about 10% are actually considered. So what becomes important is that adults that go for some type of therapy or intervention, we need to recognize that there should be a closer examination of the profile scores, because they have these spokes in the umbrella, and those spokes in the umbrella indicate and probably lead to more of a diagnosis of ASD than, say, an anxiety or depression disorder, even though they may also have those. It's certainly a lot more difficult when you think about treating someone with anxiety or an obsessive compulsion when they also have ASD. I'm going to skip to one more thing that I think is important, and that is, again, using technology in terms of identification of children, and that is robotic assessments. Okay? This is actually being developed at Yale University Developmental Disabilities Clinic, and this is probably one of the most famous clinics in the world. And they have some professors that have developed robots that get to interact with individuals with ASD in a very standardized way. And so individuals with ASD like to react or interact with robots as opposed to people, so they feel very comfortable, and they also engage in behaviors that tend to point to the characteristics of the individual. That makes it easier. Now, this is not a complete evaluation, but I think you can see where technology is going in terms of using home videos, robotic assessment, as a way of getting more specific information that sometimes might be impossible from an interview, or even setting up some type of situation or module related to looking for those characteristics. Okay. So I'm going to sort of end there because I want to give Dr. Wahlberg time to talk about his intervention program, and then maybe afterwards, if you have questions, you can ask. Okay? Thank you.
Other way.
I do the computer. All right, I'm Tim Wahlberg. I'm going to talk a little bit about autism, and I know we don't have a whole lot of time tonight, so I thought about what would be best to educate you all on. And I think that I want to talk to you about what separates kids in the spectrum from kids that are not on the spectrum, and how to develop strategies based on that. I know we don't have a ton of time to do that, but as Dr. Otori said, we'll try to leave some time at the end to answer some questions. I know we're going out to eat tonight, but I don't have anything else going tonight. So if you have other questions, please let me know. I've got my email on there. If you have questions that you don't feel like talking about in front of other people, you can shoot me an email. I have my website. I brought a couple copies of my book tonight if you're interested in picking that up. You can also, I'm not going to get through the whole presentation, so if you want a copy of the PowerPoint presentation, let me know. I think Dr. Litton has that as well. I could probably talk about autism for a week, And I have about a half hour, 40 minutes tonight, so I'll try to do the best I can to keep it contained. But if you have other questions, please let me know. One of the things I'm not going to spend a lot of time on, but after Dr. Ortiz just talked to you about diagnosing, I'm going to tell you that it's all going to change this month. The diagnostic criteria is shifting so that it's going to be autistic spectrum disorder. It's still, everything he said is accurate, it's just going to kind of be lumped together now. So we're not going to have an Asperger's separation from autism or high-functioning autism. It's going to be called autistic spectrum. Just to kind of be aware of, we were talking on the plane ride today from Chicago and driving. One of the things to keep in mind and what drives the DSM is not us clinicians, it's the insurance companies. And so I can tell you from my experience that they're not doing this so we save money as a consumer or that we help more kids. They're doing it so they make money, and I'm afraid that what they're doing is a lot of the insurance companies won't cover autism. They'll cover high-functioning autism, and I think what they figure out the last 10 years is those high-functioning kids still need a lot of therapy. They still need a lot of interventions, so what I'm afraid is they're going to put it all together now so they cannot cover anything. That's just my opinion. I hope that I'm wrong. I haven't had a lot of good experiences with insurance companies, so and I have problems with them as a provider and as an insurance carrier myself. So anyway, that's something that's going to change. That's coming out this month. Another thing to keep in mind when you're thinking about diagnostically what's going on with kids on the spectrum. Remember what separates somebody on the spectrum from all other diagnostic categories is the social disability. So it's an inability to interact and engage socially, inability to have friends, to read nonverbals, to know the right thing to say. To give you an example of that, last night I have a college group, all kids, young adults on the spectrum. And a few weeks ago I had a couple twins in there, and of course they almost sit on each other's lap. They sit, they don't say anything. They're in there for about 3 groups. And I don't make people talk. I can't make people talk. I encourage them to talk in my group. And he's been in the group, these 2 twins have been in the group. They refuse to say anything. And so, okay, you don't have to say anything, maybe next time. And so they haven't said a word. And Kevin decides, 3 groups in, that he's gonna say his first word. So now this is 10 to 12 young adults, and he doesn't know any of them. And the first thing he says is, does anyone know what jock itch is? You know, and I love my job because I love to laugh, and it just amazes me the things that I said. So the first thing that you're going to talk about, there's 4 girls in the group, is jock itch. And then I've got half the guys in there are like, yeah, I think I do. And the other guy says, no, could you explain it to me? There's 4 girls in the group, and he says, when you get right down here, it really itches, and sometimes it stinks, and I'm like, oh, let's move on. Let's share some other news. So it's called a social filter. Yeah. And so you lack the social filter. So there's some things that maybe is not the first thing you share with a group of strangers if you have jock itch, that it's really itchy. So it's also hard in social interactions. We take for granted how often we think something but don't say it. So I can say, do you like my shirt? No, that's a very ugly shirt, Dr. Wahlberg. Why would you wear that shirt? And we sometimes think, how could you say that to me? What do they think? Why would you ask the question if you don't want the answer? So I'll say, well, sometimes, you know, we don't always say exactly what we're thinking, and they'll say, well, so you're telling me to lie. I thought I was supposed to be honest, Dr. Wahlberg, now I'm supposed to lie. So the social interaction is very complex. But what separates these individuals is their ability to engage socially. Also keep in mind, diagnostically, personality comes first. Personality comes first, diagnosis comes second. So a lot of people stereotype, oh, you work with all the little computer geeky kids that are holed up in their room and don't want to leave and want to play video games. I said, yes, half of the kids I see are like that. What are the other half like? They're more extroverted. So they stand real close to you and talk, 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 talk. You say, okay, whoa, back up a little bit. Arm's length, remember the rule? Yes, I do. Talk, 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 talk. And somebody says hi to them in school. They go home, they call them 78 times because they're their friend. So there are plenty of people are extroverted that are on the spectrum. What I see happening with those kids a lot of times is they throw themselves in the game, social game, and they get beat up. They don't do very well. So I see kids that are kind of withdrawn extroverts. So I think their true personality is to be extroverted, but it doesn't go very well, so they stop trying. They're missing social cues, they're getting picked on. I have 3 daughters, and we were at Target. This is an example of an extrovert, just so you understand this young lady's on the spectrum. I get out of my truck, and it's Saturday, I got shorts and a t-shirt on, and I hear screaming, Dr. Wahlberg, Dr. Wahlberg! And Meredith is sprinting through the parking lot of Target, not looking for cars, just sprinting. And I look over and I'm like, oh, here comes Meredith. And of course my daughter's like, yeah, what do we do? She's coming right at us! And I said, guys, I know this is Meredith, and of course they want to know, is she one of your patients, Dad? I can't tell you that as she's screaming. So Meredith gets up to me and I said, Meredith, what day is it? Saturday, Dr. Wahlberg. And what am I wearing? Shorts and a t-shirt. Where am I? The Target parking lot. And who's with me? Looks like your daughters. Yeah, and she's talking shop now. And I got all these tests coming up, my anxiety, and we walk into Target, she keeps talking. I said, Meredith, I'm going to go this way and go shopping, and you're going to go that way. She says, okay, Dr. Wahlberg, we'll see you later, and off she goes. So she is extremely extroverted, and doesn't understand social boundaries, again, social filters. So a lot of the kids that you'll see, people will say, especially high-functioning kids that are very bright, oh, they're very social. Well, what happens is you have to, like Dr. Rotori said, you have to be a part of the conversation, because they might be in the mix, but they're certainly not understanding the conversation. So when you do, whenever I evaluate, I need to get school feedback, and I want to see the kids in action. Because the parents will come in, they have their own perspective, and I'm not saying it's wrong, but they have their own perspective. I have a clinical perspective, and I have a perspective as a parent. So I want to see the child in school. So I recently went to a school, and they said, we really don't think he's on the spectrum. He's always with kids. And I said, okay, well, can I just observe? Can you do some group projects? So these 2 girls and this young boy that we thought might be on the spectrum, who I was evaluating, get down and they're doing this group. He's right in the middle with them. They're drawing on this poster board. And the 2 girls are having a conversation. It was about nutrition. And from afar, looking at that, you think, wow, he's right in there with them. They're talking. Well, the girls were talking. He was there, and they're talking about nutrition. He said, do you know what? If you're fat and you get lost in the woods, you'll stay warmer longer. And the girls were like, okay, Tom. And then they go back, and they're drawing on there, and he's just kind of sitting there. So he doesn't get any feedback. And about 30 seconds later, he says, you know what else if you're fat? If you fall out of canoe into the water, you'll stay warmer longer. I guess he's right, but it has nothing to do. So if you can't be a part of that to see the social disconnect, sometimes it's hard to diagnose the higher functioning kids. Back when we started, Asperger's had just been put into the DSM. We didn't recognize a lot of the extroverted higher functioning kids till middle school. I think what happens is they kind of keep up, they keep pace, but then in middle school, I don't think social development's a straight line, but if, let's say it is kind of a straight line, you get to middle school and you're like shot up, because now all of a sudden you're not a kid, you're kind of a young adult, you go through puberty, you're talking about dating, you're attracted to the opposite sex, and then I got kids talking about Pokemon, right? And the other kids were like, well, you kind of don't do that anymore. So you see this huge social disconnect, and a lot of times you don't notice that until middle school. We're getting much better diagnostically. I like to use the clinical interview. I think I saw 30 kids yesterday on the spectrum. I do a lot of social groups, so my college group had 12 young adults in it. So I think when you're used to working with the kids, it's easier to recognize, like anything. And you know what questions to ask to parents, but I think the clinical interview is very, very important. You need feedback from the school as well. So keep that in mind. Personality comes first, and there's a lot of unique personalities in kids on the spectrum. And parents, also very unique, personalities. And parents come in and they might have an agenda. So I think your job is to evaluate. There's a lot of evaluation that goes into it. Working with kids every day, what you come to realize is so much of the information that I get is qualitative information. We're trying, Dr. Rotori talked about a lot of quantitative tests. It's still hard to do because it's based on a perspective. It's based on an opinion. It's based on watching. It's based on listening. I can't do a blood test. I can't take an x-ray. I can't stick a probe in their ear and say, hey, he's got autism. It's mild form. You can't do that. My goal in treatment always is to make the kids, 2 goals, happy and functional. Those are my 2 goals. Now, if I have an introverted child that doesn't want to leave the room, I want him to be social. He might be happy, but he's not functional. So I'm trying to get him out, and they'll say, why would you tell me to go hang with the neighbor kids when I love the computer? Why would you do that to me, Dr. Walter? You just not right. And I say, well, you need to be more functional. And I think when you look at what's changing, at least in the state of Illinois, is we're working to try to develop programs that teach functional curriculum. Problem solving, executive functioning, social skills, organization. It's not about academics when they're 25. So I tell parents, I don't care if the child's 2 or they're 18, where do you want them at 25? I've never had a parent say, boy, I hope they're living in my basement, playing video games, not working. Yeah, that's what I really want. That's not what you want, but I think we think that grades correlate with functional ability as adults. So keep this in mind when you're working with kids and you're developing strategies. Most kids learn to be social by going to school, just walking through the door, just showing up. You learn social skills. If you don't believe that, have you played the game Are You Smarter Than a 5th Grader? My daughters love playing that with me because they just smoke me. And they'll say, Dad, are you sure you're a doctor? And I'll say, yeah, I don't remember the general that was in the 1812 war, and I don't even recognize any of the 3 names you're giving me, so I can't even hazard a guess. Well, did I learn in 5th grade? I did fine in 5th grade. What did I take from 5th grade? Not who the general was in the war. What did I take from 5th grade? How to problem solve, how to engage in executive functioning, how to be social, how to listen to somebody, how to work as a group, how to get along with others. If I took you, I did a presentation, the academic world doesn't like when I say these things, but they're a reality, and I was at a high school last Friday talking about this issue, and I said, if I took all of you high school faculty and took you back to your junior year in high school, 2nd semester, and we took all your finals, how would you do? Probably not very well. And it's okay, but does that mean you didn't learn in high school? So what did you learn in high school? You learned all those things that I just listed. So now we're talking about a group of individuals that doesn't learn the same way. So I come into an academic environment and said, let's not worry about academics, let's teach them these functional skills. That overwhelms the academic environment because you're not trained to do that. Why would I have to do that? Why should I have to do that? I'm a math teacher. Well, if we don't teach the functional skills, I don't care what the grades are. Where are they going to be living? In the basement, loving the computer, drinking tea, and eating, what does he eat? He eats fish. Salmon. Salmon. And one diagnostic criteria that's not on here that you guys can say it came from me, chicken nuggets. If they eat chicken nuggets from McDonald's only. I'm not saying that's going to be included in the new DSM, but it just might be. Because I can't tell you, and parents are like,
on the spectrum.
how did you know that, Dr. Walter? Years of experience. So anyway, that's coming out, so it's going to be autistic spectrum. Autistic individuals and Asperger individuals are basically combined in the new criteria, but it will still use the same tools that Dr. Rotori was talking about. What I want to tell you just briefly is, and I'll be conscious of time because I want to be able to take some questions at the end. I think for you to understand kids on the spectrum is we have to understand what separates them from kids that are not on the spectrum. So when we talk about development, one of the things that happens, so I'm going to talk about kids that are not on the spectrum, just for about 2 minutes, 5 minutes. Kids that are not on the spectrum. So one of the things that happens at about 3 is something called social comparison. Social comparison means we're not into ourselves anymore. It's not all about me. We're going to start to notice that there's other people in the world. We're going to start comparing ourselves to others, watching others. Social comparison, if you ask a 3, 4, or 5-year-old who the smart kids are in the classroom or the neighborhood, do they know that answer? Absolutely they do. How do they know that answer? Do we teach that? Does the kindergarten teacher say, okay, class, today we're going to learn to recognize the smart kids. I'm going to teach you how to do that. Tomorrow we're going to learn to recognize the not so smart kids. We do not do that. We do not teach that. So how is it that that develops? That develops because we're hardwired to pay attention socially to what's going on around us. We don't have to teach it. My oldest daughter has it to an extreme. So when she was 5, she's now 15, she just started driving. That's a whole new set of anxiety for those of you that have kids. So she says to me at 5 years old, Dad, can you not give me a kiss at the bus stop? I said, oh, okay, Ellie, I won't, but can you tell me why? She says, well, you're the only dad at the bus stop. I said, oh, has anybody said anything to you? No, but somebody might. That's social comparison, and trust me, I am not teaching that. I'm not trying to get her to pay attention. She pays attention to a fault. When she's in 3rd grade, it was the last time I could put her hair in a ponytail, because she's standing in the mirror and she's looking, and she says, Dad, there's a bump right. And I'm looking, and that's as best I can do. And she said, then you're done. And that's the last time, so that's social comparison. So to a fault, she's paying attention to what's going on around her. And is she motivated to do so? Absolutely. Highly motivated. To a fault, as I said. My little daughter doesn't, my 6-year-old or 6th grader doesn't even know what day it is half the time. She puts clothes on, I'm like, that looks great. And my other two are like, no, Cece, no. Because they're worried about what other people will think. Social comparison peaks in middle school. Peaks in middle school. We do it all our lives. All of our lives we're comparing ourselves to others, what they're wearing, what their hairstyle is, what kind of house they live in. We're always doing that. #1 selling magazine in the world a few years ago, National Enquirer. Because we got to know. We got to know what other people are doing. What happens is it's an automatic function, so as the more we do it, the better we get. We have something that also starts to develop called a mirror neuron. A mirror neuron allows us to learn by watching. We don't actually have to do it. We can watch and learn. So you can watch somebody pound a nail in a board, and then you can kind of see how that works and grab a nail and kind of do that. As mirror neurons develop, we also then start to develop feeling what others are feeling. That's where empathy comes from. I don't have to have the experience that you do, but I can see it, watch it, you can explain it to me, and I'm like, oh, that's horrible. You truly feel that way. Another way that mirror neurons work is if you ever fed a baby with food, like a spoon, you're going, that's a motor neuron fire, or mirror neuron firing in the motor parts of your brain. So as we start to watch people, as we strengthen the connectivity, as the brain starts to myelinate, the axons are getting myelinated, we're communicating at a higher level, we get better at the social interactions. We start to understand what other people are feeling. When you watch a movie, it's a great movie, there's good actors and actresses, and you start to cry, you're not in the movie. It's not you, but you feel what other people feel. That's what starts to develop, and it's motivated development. It's not something we have to teach. I mean, we coach sometimes, but it's not something that we have to motivate because we're intrinsically motivated as human beings to do this and to pay attention to what's going on around us. The more we do it, the better we get. Does that make sense? Now, not that we're all that good at it all the time, right? John Gray that wrote Men Are From Mars, Women Are From Venus, right? Resident expert on communicating what men say, what women think. It's 2 different things. He's been married 3 times. Maybe he's been unlucky, I don't know, but it's hard. We make fun of it a lot. It's hard sometimes, but what we do is we learn to get good at it. We learn to read nonverbals and understand, and sometimes we're still wrong. Were they really mad at me? Or did they know I was joking? I mean, that happens a lot. And again, I think it peaks in middle school. It's the awkward stages. Think about middle school. Most people don't say, boy, I wish I could go back to middle school. That was the best time of my life. I want to go through puberty again. Feel awkward. Yeah, that's what I want to do. Nobody says that. So I think we come out of middle school with, you want it to be a wash. I think we have positive emotional memories and negative emotional memories. You kind of want to just say, all right, I'm done with that, I'm ready to move on. High school tends to get a little better, right? You kind of realize it's okay to be different. You certainly don't know that in middle school. So that's when that peaks, and it continues to develop. I know when I'm from North Dakota, and when I got to Chicago, I saw traffic jams. I'm like, how can the traffic stop? And so they said, I went to St. Xavier in Chicago, so I drove into the city, and I worked construction, so I drove all around, and they said it was, what do they call it? Gaper's delay. Do you have that here in Houston? Or, I guess we're not in Houston, Texas. Gaper's delay. I'm like, what? Yeah. But here's the best part. So I hear Gaper's delay, and I'm like, what in the world? It's got to be a truck that flipped over or something. So I get to St. Xavier in Chicago, and I'm like, there's a Gaper's delay. And of course, everyone's looking at me. What do you mean? I said, well, what is that? And they're probably all thinking, you're getting a PhD. And I said, well, what is that? And they said, it's people rubbernecking. It's people looking at what's going on the side of the road. Here's the worst part. I didn't believe them. I said, that can't, how does it slow traffic down in 2 directions? And no, it's not that people stop. Right? You slow down, ooh, that looks bad, let's keep going. We don't stop, we just look, we gotta look, that's social comparison. We pay attention to what's going on around us. One of the things that Dr. Auditori talked about is eye contact. So one of the things that you learn through social comparison is how long to look at somebody. Right? You learn that. Because if you're, think of it this way, if you're in a restaurant, somebody's staring at you, you don't know, how does that make you feel? Yeah, isn't it kind of awkward? You don't say, hey, you've been looking right at me this whole time. Right? I just thought I'd introduce myself. You feel uncomfortable. So do kids on the spectrum. Times 10. Right away, immediately. They don't know when to look away or not look away, so they get overwhelmed by it. I also learned when I'm driving and you're in gridlock and you know somebody's looking at you. You ever been there? Yes. And you just feel it, and you look over and they're just staring. How uncomfortable you feel. The kids on the spectrum feel the same way, but it's times 10. It's magnified. Same things we feel, they feel times 10. When you meet somebody new, maybe you're a little nervous, a little awkward, they feel that times 10. Times 10. And what I find, what I've learned over the years, is a lot of the kids, as Dr. Auditori said, there's comorbidity like crazy with anxiety and depression and OCD tendencies, ADHD, there's all kinds of comorbidity. And what I see with the anxiety, so if I have anxiety about being with people, how do I avoid that anxiety? Not be with people. So the problem, all these years of this social comparison that's taking place, motivated social comparison year after year after year. Kids in the spectrum are not engaging in that activity because it's overwhelming, it's overstimulating, and so they find other things to do. So one of the things that happens, just real briefly, is as we get better at being social, we learn to incorporate what I call unpredictability. So you learn to manage when things don't go exactly the way you want them. Does that make sense? So it never goes exactly the way you want it, right? Ever. So, like, for example, here's problem solving and executive functioning because I'm planning on things not going the way I want them to. I got up early this morning to drive to Midway, which should be about an hour and 15 from my house, hour and 10 from my house. It's an hour and 45. But I account for that. So I'm not really overly stressed. I don't like sitting in traffic. And I like to look at people and see if they're staring at me. But it doesn't really bother me because I'm planning on that. I incorporate the fact that things might not go the way I want. So what we learn, the more we become social, the more we learn to be flexible. We adapt. Do you remember, I'm going to talk a lot about anxiety with kids in the spectrum. Kids in the spectrum feel the same anxiety that we do, only they sometimes with things we find to be fun anxiety, positive anxiety, they have negative. They might ask the same questions. You go to a party, who's going to be there? Ooh, this is exciting. What are we going to do? Who's going to be there? That's positive anxiety. They're saying the same things, but they're saying, I'm not going if I don't know who's there. And if I don't know what we're doing, I'm not going, because that's negative anxiety. Do you remember when you were in middle school and high school and you had a substitute teacher? That was like, oh, yes. Substitute in Johnson's class. Because why were you excited? Because you didn't have a teacher. You could screw around a little bit, goof off, you had a different set of rules. But it was exciting, it was fun. That spread around the school like wildfire. My favorite was in band, because I played the trumpet. But when you had a substitute, I played the drums. Oh, substitute band!
This is why there's a shortage of teachers.
Yeah. I remember one time the substitute's like, Walbert, what's wrong? I'm like, I'm just having a bad day. But the same thing, so with somebody on the spectrum, what do they feel when they find out there's a substitute? They feel anxiety, like, oh man, I don't want to go to school. Now we've changed things. I don't want to go. I had a kid come in, it was hard, it's hard not to laugh, but he says, I said, how was your day? And I hear this 20 times a day. Worst day ever, horrible, I hate school, why do you make me go? It's horrible. So I said, well, why was it horrible? We had a substitute band. Right away I'm like, oh. I can remember those days. And I said, well, why was it bad? And he said, well, my teacher lets us warm up for 10 minutes. The substitute has us warm up for 5. I said, was there anything else that, nope. So your whole day is shot because you had a substitute teacher and they warm up for 5 minutes different than the other substitutes. So as we learn to incorporate unpredictability, we even like it, we thrive on it, it's fun. Kids in the spectrum are the exact opposite. Exact opposite. So also something real quick, we learn to be flexible. The brain is an energy transformation system. What I mean by that is we're born with a certain amount of resource. Let's say it's like a 9-volt battery. What happens as we get better at something is we use less of the 9 volts, so the brain learns to be efficient. Those tasks become automatized. We can do multiple things at one time. So if you talk to a baby that's learning to walk, and the baby listens, it'll tip over. All 9 volts go into walking. That's where if you can't walk and chew gum comes from, so if you know somebody who can't quite align that balance system yet. But what happens is, as we get more efficient at something, it takes less energy to do that task. So when you learn a new skill, like driving, first time you learn to drive, remember how you had to put all your effort and energy into it? You couldn't do something, turn the radio down. I had an 8-track player. There were no cell phones, so I turned my 8-track down, a little Barry Manilow perhaps, turn that down. I can't have any distractions because it's a cognitive task. All my energy has to go into driving. But what happens as we learn to drive? We get better at it, we become more efficient. So driving goes from a cognitive task to an associative task. Now, in Chicago, driving now is an associative task for me, but it can change to a cognitive task. So if I'm driving with the girls and we're laughing and we have music going and the roads get icy, what do? I tell them to be quiet, turn the radio down, because I got to concentrate. Sports are the same way. Musical instruments, same way. Once we learn it, we become automatized. Social interactions the same way. Reading nonverbals is the same way. Understanding other people is the same way. I think it's more complex than driving or playing a musical instrument. The reason I put this up here is what you have to understand about kids on the spectrum is tasks that should be associative are cognitive. So I have kids in my office that say, well, I can look at you or I can listen to you. What would you rather? And I'll say, I'd really like you to listen to what I'm saying. Okay, but I'm not going to look at you. I said, that's fine. But in school, to demand respect, what do we need? You look at me, and I think my kids in the spectrum probably, okay. And they won't, it's like the teacher from Charlie Brown, wah, 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 wah. And then the kids in the spectrum, just like we will do, the teacher will say, do you understand? What will they say? Yes. And why do they say yes? Because you will stop talking then and not say anything else. And we do that too. If you're at a party, somebody tells a joke, what do? Right? You laugh, you don't say, oh, hold on. It's Tim again, that's the 3rd one in a row, but I don't get this one either. Somebody please tell me what's going on. So, kids on the spectrum do the same thing, so don't assume they know. Ask them to explain it. So I'll have parents in my office, a child on the spectrum, I'll explain something, and I'll say to the child, do you understand? Yes, I do, Dr. Wahlberg. And I'll look at the parents and say, do you think they understand what I'm talking about? Oh, sure. He said yes, of course I understand. So I'll look back at the kid and I'll say, can you explain what I just said? No, I cannot. And I'll say, why not? Because I have no idea what you're talking about. They do that all the time. So you can't assume that they know. They need to explain it to you. So a lot of interventions involve, tell me what I just told you. Explain it back to me. Kids don't necessarily like that because their plan doesn't work. Because remember, their plan is to not talk, not engage with you. So parents will say, why they won't let me check the homework? Why do you think that is? What happens when you check the homework? There's only downside to you checking your homework. There is no upside. None. So I'm going to check your homework, which means I'm going to show you what's wrong, which means you got to redo it, which means more work. And do kids on the spectrum, a lot of the kids, do they care about their grades? No. That's a social thing. Most kids are intrinsically motivated to do well. The teacher's going to be proud of me. My parents are going to be proud of me. Other kids will see that I get good grades. Kids in the spectrum don't think that way because that's a social thing. Kids in the spectrum are saying, what's in it for me? Take out your math book. I don't think so. I don't like math, and I don't like you as a teacher. And then now, get him out of my classroom. Obstinate. It's a defiant child. Well, the kids on the spectrum need to know what's in it for them. So I had a mom that said to me, I'm not going to, this boy had braces, he's in 7th grade, she said, Dr. Wahlberg, are you telling me that I have to motivate them to do everything? I said, well, or she said bribe. And we're talking about like self-care. Like, why would I care how I smelled if I brushed my teeth if I really wasn't interested in people? Why would I care? I really wouldn't, because that's a social thing. Whether we shower or not is a social thing. And so she said, I am done with the teeth brushing. I said, I don't know if I'd recommend that. He's got braces, and I don't think he's going to brush his teeth. Well, he should know that, and he'll get cavities. I said, I'm really telling you, of all the things you want to pick, let's not do that one. She's like, nope, I'm done. So he comes back in, and his braces are off, because he went back to the orthodontist. Had to take the braces off because he had 27 cavities. 27. So would have probably been worth it to watch, because those are $5 grand a pop. And I don't know how much a cavity is, but you're into it about 12,000. And are you going to put braces back on? Not unless you're not going to watch him brush his teeth. So you have to motivate. And remember, a bribe is when you're asked to do something you shouldn't do, not something that you should do. So I pay a kid right now minimum wage to talk to me in therapy. I think we negotiated $8.25. I said, I'm not, why would I talk to you? I said, I'll pay you. He says, okay, how much? I said, minimum wage. He says, deal. I get more therapy in 50 minutes from that. He talks for 50 minutes. I said, you gotta be honest, you gotta answer my questions, and I get 50 minutes. He says, that's fine. It'll cost you $8.25. And I said, yes. I had 5 boys in a social skills group. Introverted boys. This was, gosh, 12 years ago. So I'm just kind of getting started out. I got 12 boys in there, and 12-year-old boys. So they're coming after school. They don't want to be there. They'd rather be playing video games. They're tired. It's a long day for them. They sit in my group, and I'd say, Pete, why don't you ask John what he did this weekend? He says, Dr. Walber, I don't care what John did. Yeah. So I'm trying to find a way, and so they're not motivated to ask questions. What I want to teach in social skills group is to listen to what somebody else is saying and ask questions about what they're talking about. Not deep fat fryers, not stoplights, not fire hydrants, not air compressors, but I want you to listen to what they're saying and ask them a question. So this group, I'm sitting there and I said, I'll tell you what, guys. I have a bunch of groups that I'm doing right now. Whatever group asks the most questions in their group time, I'm going to have a pizza party. And they said, in the group room? Right here. You're going to get us pizza and we're going to eat it in the group room. I said, absolutely. 45 minutes later, they had asked 180 questions. And they'd say, Pete, what are you doing this weekend? Dr. Wahlberg, that is a question. And I just sat for 45 minutes. And so I got a pizza. But what started to transform all of a sudden is they're kind of interested. They've never had the experience of talking to anybody, to asking anybody anything. They all of a sudden are like, hey, did you see that Iron Man 3 movie? Well, how was that? But it might take me a year. It might take me 18 months. I tell parents it'll take about 2 years in my groups before you'll see change. 2 years. Of me motivating them to speak to each other. So we'll have games, we'll have competitions, we'll have contests. Who can remember the most that was said? We'll do that, and all of a sudden that becomes the norm in my group. And then I'm hoping that that generalizes outside of my group. Because the simplest way to get involved in a conversation is to ask a question. I don't have to know anything about you, anything about what you're talking about. I can say, what are you talking about? I'm in the conversation. I'm in. So if I can teach them to get into a conversation, be involved in the conversation, have confidence, to lower their anxiety, it tends to work pretty well. What I really can't teach them is how to make up for 18 years of unmotivated reading nonverbals. Because we don't even really do that perfectly. So instead of spending all this time on that, I like to teach them how to compensate. I can teach them to say, I'm going to talk about deep fat fryers. Would you like to hear about deep fat fryers? If you say yes, I'm going to tell you 3 things. And at the end of those 3 things, I'm going to say, would you like to hear more about deep fat fryers? And you're probably going to say no. So if you say no, I have to be able to say, okay, do you have anything you like deep fat fryers? And then I need to listen to you and ask you some questions. Maybe you're really interested in deep fat fryers. Coffee makers, yeah. So, but I can teach those skills. And a lot of it has to do with lowering anxiety, right? Because a lot of the kids can sit and talk, but they're so anxious it shuts them down. As soon as a child gets anxious, the problem solving, executive functioning, all of that just goes, and then they shut down. And when they shut down, they're not going to talk. And a lot of times when you're working with adolescents or young adults, they'll say, if they're in your office, just don't talk, it drives them crazy. If you have a child on the spectrum and you don't talk, they're like, I like going to see that Walter. He's great. He doesn't say anything. He doesn't challenge me. He doesn't say anything to me. So it's very different with kids on the spectrum. So keep in mind, you have to evaluate what's an associative task and what's a cognitive task. The other thing that you need to understand, I've kind of hinted about this, but kids on the spectrum are developing differently. And as Dr. Autism said, kids on the spectrum come into the world and they're overwhelmed by the environment. It doesn't make sense. It's too loud, it smells too much, their skin, it bothers them when they're wrapped up, looking at somebody overwhelms them, kinesthetically, proprioceptively, vestibular, all these systems can be just overwhelming to the kids. I think what they learn to do, because of the environment being overwhelming, is they control the environment. That's where you see the autistic behaviors. So you might see stimming, which is that repetitive, and it's relaxing, it's calming, it calms their systems down. Their systems aren't able to do that on their own. I'll try to show you a slide if I have time tonight, but most people's systems habituate to the environment. So you have sensory information coming in, your brain looks at it, says, don't worry about it, I'm going to ignore that stimuli and allow you to focus on things. Kids in the spectrum, that information comes in and it's loud and overwhelming, so what they do is they say, ooh, a car, I'm going to spin the wheel of this car. Now that's control, and it's tuning out the environment. So I had a little boy years ago. Parents thought he couldn't hear. He'd sit and spin his car in the kitchen. They went up behind him and slammed pots and pans together. He didn't flinch. They took him in to get his hearing tested. His hearing was fine. I think they can hyper-focus to such a degree they can shut other senses off. So I tell a lot of the kids you have superpowers. You can use them for good or evil. I want to teach you how to use them for good. If you hyper-focus on something negative that causes anxiety, you're not using it for good. But you can teach them to do that. So I think they can shut senses off. I think we can do that on some level. We're not professionals like kids on the spectrum. If I'm watching a football game, it's 4th and goal, last play of the game, and somebody's talking to me, I'm not going to hear them. Probably won't even know if they're talking to me. But that's a small win. That's only a very brief moment of time where that happens to me. I think kids on the spectrum can do it all the time. And keep in mind that as they control, they develop this very black and white way of living in the world. As long as everything stays the same, I'm fine. So they don't develop accountability. So if you would have taken me to Target at 4, I wouldn't have torn the door off the hinges. So it's actually your fault because you didn't do what you said you were supposed to do. So again, it's this black and white perspective that things should go a certain way. So you wonder why depression develops, anxiety develops. How many days have you ever had that went exactly the way you wanted, start to finish, where you got in bed at night and, wow, every single thing I wanted to have happen? It never happens. My day started at 4 in the morning and I hit traffic. That is not what I wanted to have happen. But it's like, okay, I planned for it, it's no big deal. Kids in the spectrum that are trying to control, want things to be the same, don't like change. Don't like to change anything. So when you say there's a substitute day, that's not cool. When you move the furniture in the house, that's not cool. When you change your hairstyle, that's not cool. Any changes. One of the first kids I ever dealt with was in my office because he had so many problems at Christmas because for the first time in 17 years, Mom put up a Christmas tree. And I said, well, okay, what's wrong with that? Well, the couch moved 3 feet. Okay. And, well, the couch moved 3 feet. There's a Christmas tree in there. And I said, well, what, are you going to have a Christmas tree when you own your own house? And he says, yeah. And I said, well, how are you going to do that? And he said, well, I'm going to build a nook that sticks out of the living room. And I'm going to put the tree in that nook. And I had to ask, and I knew the answer. I said, well, what are you going to put in there when it's not Christmas? And he looked at me and said, well, nothing. That's where the Christmas tree is. That's control. But when they control, when things stay the same, what does that do to their anxiety? Lowers their anxiety. So a lot of what I try to do is teach them how to manage their anxiety. What I try to do is get them to use their superpowers to control themselves. As the kids get older, they want to control things out here. And the anxiety develops and the anger develops because they cannot control out here. As a child, maybe they can manipulate, they can do some things, but as the natural consequences start to blend in, they realize, I cannot control other people. So you have to teach them to control themselves. if they can turn that energy, that hyper-focus on controlling themselves, controlling their anxiety, reading their anxiety, paying attention to when they're starting to get angry. I think a lot of kids are misdiagnosed with bipolar, because mom will say, man, they're fine, and a half second later, it's a thermal meltdown. I don't even know why. So if you're black and white, keep in mind, if there's a black and white, it's either good or it's bad. There's no in between. It's either a good day or a bad day. And keep in mind, it's about their perspective, so it's their perspective of what a good day is. So if my perspective of being a good student is I need to get 100 on my math test and I get a 99, what happens? I have a thermal meltdown. Yeah, because that's not good. And so my job, and what I talk about in the book, is trying to teach them to find that middle ground. Trying to teach them how to evaluate a situation honestly. And I think what happens with some of the young adults that I see is they feel anxiety about being social. So they create misperceptions. So there must be something wrong with me because I feel this anxiety, and then they try to quantify it. So let me give you an example. A young lady comes in, she's 28, and I don't know how she manages, but I diagnosed her with Asperger's. She worked at a grocery store running the cash register for 4 years. And she could only work every other day because she needed the whole other day off to recover, and she'd sit in her room in the dark and rock. And this is a very high-functioning young lady. So I said, well, I was amazed that she worked at cash register. So I said, well, how does that go? And she said, oh, I do a terrible job. Terrible. And I said, okay, give me the data. I'm always talking about data, because data is black and white. Data is black and white. It's all data in my office. It's all visuals. So I said, give me the data. She kind of looked at me and said, you've been there for 4 years. How do you know? Who has said that you're doing a poor job? Have you had a supervisor say that? Have you had another person in the checkout line say that? And she just looked at it. And she said, well, I don't remember any. I said, okay, from now on, take this notepad and you write down when somebody says you're doing a poor job. She comes back 2 weeks later, nothing on the notepad. I said, so where is this not doing a good job thing? She goes, well, I guess I do okay. And not only does she do okay, but she overcompensates. She's the nicest checker there, because she's worried about not doing things right. So it's this creative misperception that I have to show her data to change. So with most kids, you say, oh, don't worry about it. Just calm down. And how do kids react? They react based on your demeanor. So we had a tornado siren go off in my neighborhood. So the kids were little. I said, we got to go in the basement. I got a little TV in the basement, and I was kind of looking out the back window. And I can tell in my house when my 3 daughters get quiet, it's not good. Something's wrong, right? So all of a sudden it gets quiet. I turn around, and they're all 3 standing in front of the TV. And they're like, Dad, is this what's going to happen? And it was Storm Stories it was on. And it was a tornado ripping through downtown Salt Lake City. And I walk over and I'm like, ooh, let's change the channel. And I said, hey, no, that's not oh, don't worry about that. And they kind of looked at me, and kind of looked at each other, and I'm like, oh, no, and they're reading my emotion. And next thing you know, they're fighting, everything was back to normal. I can't say that to a child on the spectrum, because that's a social thing. They're not reading me, but when I have data, and I can give them data, and I'm not saying I lie about my data, but I use the data to my advantage so that I get them to change perspective. So an example is a kid comes in and mom says, oh, we couldn't get him out of the car because it's raining. And I try not to guess, because I'm always wrong. I'm doing this I see so many kids and I'm always wrong, so I'm like, try not to guess, but I think, oh, it's a sensory thing, the water, he doesn't like it, it hurts, he doesn't like being wet. So he gets in, and this is what amazes me sometimes, is we don't ask them why. Parents don't, teachers don't. So he sits down and mom says, oh, I can barely get him out of the car. And so I looked at mom, I said, well, why is that? She says, I don't know. I looked at the kid and said, why is that? He says, because I don't want to die. And why would you die from the rain? I said, well, the poison. I said, well, so now I start thinking acid rain or something. Like, well, what poison? He says, well, when the poisonous reptiles and bugs go to the bathroom, it gets on the ground. And when it rains, it puddles up. And if I step in the puddle, I get on my skin, I'll die. And I said, okay. So now what I can't say is, oh, don't worry about it, because he legitimately thinks that's going to happen. So I acknowledge his anxiety, because his anxiety is true to him. It may not be to me, like what? But it's true to him. So I said, well, what are we talking about here? What poison is? He says, well, the tarantula. So I have my computer there, and I go to where does the tarantula live? And I said, well, look, there's no tarantulas here in Chicago. I said, what else? He says, the black widow spider. Type that in. Luckily, that only comes halfway up in Illinois. I said, there's no, we're not in southern Illinois. I said, what else? He says, the king cobra. Type that up, and I said, well, these things aren't even here. So I try to find an angle. So instead of getting into the biology of every critter that's poisonous that doesn't come out when they go to the bathroom, I just say there's none of those animals here. Now, he's probably not going to hang out in Arizona, Texas, or Florida anytime soon. But I'm trying to make that done and move on. And so he's like, well, I guess I don't have anything to worry about. I said, and the cool thing about kids that are black and white is it's like a light switch. What he was worried about, he is not now. So where I think our emotions are like a dimmer switch, I can get worked up, but it takes me a long time to get angry. Where they're like, boop, boop, and then just as fast they're not. So mom says, you go upstairs and don't come down until you apologize. Mom's crying, sweating, it's been 2 hours of torture. Kid goes upstairs, walks through the bedroom door, walks back out, comes down, says, I'm sorry! Can we go to Target now? And mom's like, well, no. I'm still upset because they're done. They switched off, they're done, and then now they're really mad. What do you mean you're not taking me to Target? I just did exactly what you told me to do. I went upstairs, went in my room, came down and said I'm sorry. And mom's still like sweating and so but that's the black and white perspective. That is the black and white perspective. So what you're dealing with when you're looking at interventions, when you're looking at therapy, when you're looking at communicating with them, is it data-driven? It's black and white. What you are able to do is take an abstract brain and make it black and white. We have the ability to do that. What kids on the spectrum, adults on the spectrum struggle with is going from black and white to abstract. So if I'm going to speak abstract to them, that's like Charlie Brown teacher. They're not going to understand that. They're not going to make sense of it. But if I can make it more concrete, that's where schedules and visuals come into play. Right? Think of all the visuals we have. Driving out here, there's lines in the road. What if there wasn't lines in the road? What if there wasn't stoplights? We use visuals all the time because it calms us down. Go to the bathroom. I struggle sometimes when I'm like at a Mexican restaurant and I can't tell what the decals are. I better wait to see who comes out. I can't tell. We use them all the time. So imagine a world that doesn't make sense. So the more consistent you make it, the more you lower the anxiety. The more you lower anxiety, the more they become functional. So I talked about the 9-volt battery. I think 9 volts a lot of times goes into survival. Just making it through the day. So where do we send these kids? The worst place we could send them. I'm going to put you on a yellow tube that's really loud. There's no escape. You might be on there for 45 minutes. You're going to go to school and do a bunch of things you don't like. You probably won't like any of them. We're going to make you do them. We're going to smash you in a classroom with 35 kids. It's probably loud. It stinks a little bit. And I'm going to add, again, I couldn't pick a worse environment. So a lot of the kids will say to me, you're not listening to me, Dr. Walter. Because I told you how bad school is, you still send me. And a lot of the kids don't understand that I'm listening, I'm just not agreeing. So what they think is, I need to tell you louder now. Because remember, their perspective, is their perspective right or wrong? It is right. I will tell you it's right. You're not listening, because obviously you didn't agree with me. So again, you have to work with that. And I teach them that, yes, I'm listening. And what I do is I'll say, do you want me to repeat word for word back to you what you just said? Because I would be happy to do that. They'll say, go ahead. And I'll repeat word for word. I'll say, let me tell you why I don't agree with you. But if you don't do that, a lot of times we think they're going to read our emotions and understand. They do not understand unless you tell them. Unless you spell it out, unless you make it black and white. So in working with them, you have to understand that. With the interventions, you have to understand that. With the strategies, you have to understand that. It's very difficult for them to see the middle ground. I know I'll have 1 minute for questions. Hope that's plenty of time for you guys. I know it's 6:30, and I know you guys probably have other things going on. Dr. Rotori and I would be happy to answer questions. Do you have any specific questions now? You all good? Yes, sir.
You indicated that the stemming calms down. What exactly is, I know that happens, and I see it every day, but what is actually happening?
Neurologically, let me show you. me see if I can find this slide. Here's my executive functioning slide. So what I want to show you that kids on the spectrum can't do. I know I got distracted. I have a little ADHD, but I'll get to your question. What happens, like if a kid picks a rock up and he sees a window, what happens is he's picking up the rock, he's thinking about throwing it through the window. He hasn't thrown it through the window yet. He picks it up, he looks, he thinks about the behavior, which is throwing the rock, but then he thinks about the outcome. If I throw this rock, the window will break, but you know what, my buddy did that, he got in a lot of trouble. He had to pay for it, he was grounded for 6 months. I don't know, he got arrested, so then what happens is it comes back to here. And we make a decision. Some kids still throw the rock, right? But you thought about an outcome. Kids in the spectrum pick up the rock, they throw the rock, and now you say you're in trouble. They're like, are you kidding me? I didn't know that. How can you tell me I'm in trouble when you never told me that I'd be in trouble with throwing the rock through the window? And you didn't tell me I couldn't throw it through that window, you said that window. And they're beside themselves. So what you have to do is stimulate the outcome with kids. So they pick up the rock and you stand next to them and you say, let me tell you what's going to happen. You throw that rock through the window. And you give them the outcome. So what I teach people to do is give them 2 options. Get A or B. Here's what's going to happen. If you don't throw the rock, you're not going to get in any trouble. You're going to be able to play your video games tonight. If you do throw the rock, here's what's going to happen. No video games, and you're going to have to think about it. Now, what are you going to do? Because now you're teaching accountability. So when they come back to you and you say you're in trouble, you can say, well, you made the choice. I told you what would happen. You chose to do that. And I'll say to kids a lot, why would you choose to lose your video game? And they'll look at me. Because I'm always saying, what do you have control over? You have control over yourself and your choices. I'm sorry I got distracted on that. Here's what I was talking about. So, try to ignore this side for a moment. This is what happens neurologically when we habituate to the environment. So your brain and your body is trying to stay at homeostasis, which is this bottom line. Calm. Sense of calm. Stimulation comes in. So one I like to use for an example is you put clothes on, that's tactile stimulation. And I know you've all experienced that today because you're all dressed. So you get up in the morning, put your clothes on. What happens is excitatory neurons fire, and it says, ooh, there's something on your skin. What happens is the brain, if you reach a certain threshold, the brain looks at that stimulation and says, you know what, though? It's not a problem. It's nothing to worry about. So then inhibitory neurons fire, even though you still have your clothes on. Inhibitory neurons fire, bring you back to homeostasis. So you habituate to the environment. We do that all day, every day, with all sensory channels, every single channel. You hear the fan going from the overhead? How many of you cannot tune that out? A couple is hard, right? Because that is drawing your attention. You can't habituate to that. What happens for kids on the spectrum? Remember, we have this hypersensitivity. So if they're tactily hypersensitive, what we're finding in research is it's not that they have more receptors in the skin, but when those neurons get to the brain, the volume is just cranked way up. So kids get bumped, they feel like a Mack truck hit them. Literally. It just feels like wham, even though it's just a touch. So if they're tactily hypersensitive, and you can tell this in an early childhood classroom how? Those are the naked kids. You walk in like, oh, Junior's got a little tactile hypersensitivity because the shoes just go, and if they can be naked, they are. And it doesn't matter if it's 40 below zero. They got shorts on that are this big and like a huge t-shirt because they have tactile hypersensitivity. So what happens when they put their clothes on, excitatory neurons fire, but they get stuck in this state of excitation. So they have 2 options. I can either get rid of my clothes, get rid of the stimulation, or I can distract myself. I can find something else to focus on, something else to think about. What I generally find with the younger kids is they continue to activate excitatory neurons. So that's where you get the movement. So the movement is giving them more stimulation, which activates inhibitory neurons.
To get it up to that level?
Yes.
So,
Yep. So, because you think about it, so when I was thinking about this theory, well, you can't concentrate here. No. You're in defense mode, man. You're trying to figure out what it is, and of course, we have no social filter, so I don't care if it's picking my nose. I had a kid in high school group, and there was the girl Meredith that chased me down, like, Ryan, get your finger on your nose. The other 4 guys don't care. But she's like, this guy, he's like, this is what I do when I'm nervous. So there's no social filter. That's what he does to calm down. That's excitatory neurons. So we see a lot of that odd behavior as a way to regulate, to calm down, but there's no social filter. So the kids that walk down the hall in flat, I was watching, I really don't watch TV. The only thing I really have that I turn on with any consistency is ESPN. So I flip the TV on, my daughter's sitting with me, and ESPN comes on. It's a spelling bee from a few years ago. My daughter was younger. And I don't try to find the spelling bee just for the record. It just happened to be on TV. And I said, well, let's watch a little bit, Ellie. So the girl that ends up winning, she gets up to the mic, and they're just, all of them are like this. And they go through the whole, give you the origin. And it's interesting to have a PhD, not know one word. Talking about, so she stands there, and she starts spelling the word, and she goes, B. A. And of course, my daughter's like, oh my God, Dad, what is she doing? Doesn't she know people are watching? Why? Turn it off, I can't watch it. But this girl has no social filter. What does she do to calm herself down? And what does she do for fun? Study spelling words. Where do the 9 volts go? It's not hanging out with her friends. It's studying spelling words. So what she does to regulate, when she gets nervous, is she needs movement. So some of these kids, like, they'll go on a swing for hours. Bill Gates, now I've never assessed him. Some think he's a little quirky, perhaps he's on the spectrum. He has got a room in his house that the whole floor is a trampoline. He comes home after work, he doesn't work anymore. Well, his work now is to give away his millions. So he gets on the trampoline and jumps, and you know why he says he does that? To process his day. Because it's easier to process when I'm activating the inhibitory neurons, because now my body's calmed down. I had a young man who went to full regular ed high school and went to football practice. He never really played, but he liked to bang into people. And then he'd come home and he'd get on one of those little mini tramps from the 80s, remember? He'd exercise. He gets on that, and I said, well, how long do you do that? So this is after 7 hours of school, 3 hours of football practice. He said 2.5 hours. And I said, wow, do you take breaks? He says, no, sometimes I go fast, sometimes I go real slow. I said, well, what are you doing? I don't know if any of you have tried a mundane task like that. And I said, what are you doing? He says, well, I'm processing my day. So he goes back through, tries to make sense of his day. So I think he goes in survival mode, right? And he just stores and just tries to get through the day. And then he comes home and so some of the kids figure out how to do that in appropriate ways. Some of them are not appropriate. What happens, I think, unfortunately, with most kids, there's just a brand new research study that came out. And in my office, it is one of those things where you hear it and we call it a no shit moment. So it says, autistic kids prone to video game addiction. And I said, no shit. Because a lot of the kids, that's all they want to do is play video games. But the problem is, now what they're doing is they're blocking this out, but they're not regulating. So they're in school all day using cognitive resource and not getting the physical movement that they need. They come home and what do they want to do? They want to sit and play video games. Now you've got a transition issue because they surely don't want to get off the video game to play or to do homework, and they're dysregulated. So now they can't. So what I try to get parents to do is have them come home to some sort of sensory. I don't care what it is. They need some movement because they sit all day long. And they're not running around like the neighbor boys, banging around and running around, getting that energy out. So they want to come home and sit. So I try to get them some physical activity. And then what I say, and it's first then, which is black and white, first we're going to get our homework done. Then you can do your video. Then you have free time. We use a lot of visuals and things like that. So it's changing that schedule. A lot of the kids that are older, I try to teach how to regulate. Because they don't know how. And so they avoid it by hyper-focusing on something like video games, but they're not regulated then. So I think they're in a constant state of dysregulation a lot. And then they find a video game. What a great world for them. The rules are consistent. It's the same every time. There's no social interaction. They love that world. Because now there's a world that makes sense. Because it never changes. When I step out and the bullet hits me, I die. Every time, this is great. And I know how to turn it off and turn it on. That's not the social world. That's not the world they live in. So when they find that environment, they love it. Now, the new most favorite game is Minecraft, which is the computer version of Legos. They get to build, and they're in ultimate control. Ultimate control. So I think that's a bad thing, because it takes us farther away from where we want to go. A lot of the kids say, oh, I got 576 friends on Facebook. I'll say, have you ever met even one of them? Well, no, but I have 576 friends. You know, so we're getting farther away from socializing, unfortunately. So I try to modify and get them to schedule and do things like that. But that's what's happening neurologically, and that could be any sensory modality. Absolutely any sensory modality. So there's a lot of people that, when they feel unregulated, they like movement, they like music, they like running, they like exercising, and that calms their body down. I'm a lot like this. Movement is very relaxing to me. Music, the louder the music, the calmer it is. So I used to get written up in college because I'd blast my music, and people thought I was drunk, passed out. And it just relaxed me, and I'd fall asleep. They knock at the door, I'm like, what's the problem? You know, the music's just because it was very relaxing.
Okay, so you try to transition that stemming to another activity.
Well, no, not necessarily. Now, I'll try to transition it if it's in a social environment, but I don't want to take it away completely because that creates more anxiety. So what I'll try to do is say, you're going to do the stimming before school, and then maybe 3 times at school during the go to the social worker's office and try to do it right after school. Then I try to gap it out, while at the same time giving them something else to do. Because I cannot necessarily get rid of what's causing the anxiety. So it's being in school, there's too many people. Well, I can't change that. But I can, what happens, it's interesting, when you try to remove something that they like, that's black and white, they get into this. They think I'm never going to, and then the obsession starts, how about now, how about now, how about now? But when I say, okay, hold on, you can do that at noon. So I'm not saying no, so sometimes that breaks that cycle. Because there's a lot of things we do at home that we don't do in public.
Right, and I noticed that. I mean, it was
Quite a few things.
to soccer practice,
Mhm.
and then he won't do it.
Mhm.
So.
So there's some
my
social
concern-
awareness.
My concern is that I don't know what is triggering that, because. he's
What's
sitting there-
triggering what? The stimming on the way to soccer?
Yeah.
He always stems when he's really, really excited.
Yeah, I would say he's nervous, he's excited, he's going to a social environment. Soccer tends to be a harder sport. Any sport where you have to predict where other kids are going to be tends to be a challenge. So I like to get the kids to do golf, swimming, tennis, cross country, track, where you're still on a team, you're with kids, but you just run there. You don't have to worry about what anybody else is doing. Don't worry about Joey and Pete and Sam, just go right down. Because that tends to work better. And then they feel a part of the group, they can be successful, you know, and that's a harder sell because they don't like running a lot of the time. A lot of them like water, and I think that's a sensory thing. It's that pressure, but it's not too much pressure. So I try to get them to do other sports. A lot of kids do team manager, things like that. So they're part of that club. You know, a lot of the kids, they have social disabilities, so they don't understand, oh, I'm going to go for soccer. You're 17, you've never played before. I'm going to play varsity. But these guys have been playing since they were 2. You know, but that's a social perspective. I'll just practice a little.
Yeah, he wants to play man,
Yeah. Well, but I think I've had kids, you know, not many, but I've had kids that have been successful in the team sports, but that's a rarity. Because you have to predict what other people are doing. That's executive function, and that's hard. It's hard for some of the kids to do. Yeah.
What were some of the changes in sleep or differences in sleep between autistic spectrum people and norms?
Changes in sleep.
Yeah, there were sleep problems?
I think a lot of the sleep problems stem from anxiety. So the problem when we have anxiety, and a lot of these kids do, there's a lot of comorbidity, is they have stimulation all day, and the first time they don't have that stimulation is when they go to bed.
Have there been any studies actually looking at sleep architecture in these kids and instead of
I'm not as familiar with that. I can tell you a lot of strategies for it, but I know that when their system's dysregulated, they can't sleep. A lot of times they have misperceptions. Here's a strategy that works 50% of the time with little ones, because it's about belief. Anxiety is about a fear of what we cannot control that creates anxiety. So what I tell the kids is, if you have a bad dream, flip the pillow over, the other side's a good dream. That works half the time. As long as they believe it. Dr. Wahlberg said, this is the good side of the pillow. That also worked with the neighbor girl. As I told my daughters that, and they told the neighbor girl, she came up and said, oh, thanks Dr. Wahlberg, because I don't have nightmares anymore. I'm like, What are you talking? Why do you think? Oh, Ellie told me if I flip my pillow, the other side, it works half the time because it's belief. So when I'm presenting data and I present data that they think is factual, it's wrong. It's just boop, done. I can dance in the rain now and swim in the puddles because there's no poison, Dr. Walden said. And trust me, the kids on the spectrum are the same. You know, I have 3 daughters. I'm going to go with the flow. There's a storm blanket that I have too. It works the same way. Yeah, I suppose we can. Are there any other questions? How to turn the lights on? I don't know. Is it? Like up here? Apparently it is. I'm going to try to calm down a little bit.
Okay, not being familiar with Alcorniana, I'm not quite sure what's going on.
Are there any? There could be. Are there any other
I
questions?
have a question.
Go ahead.
A child with autism is, is in the classroom at one long with special needs, with only a group of 5 or 6 kids. How do we, in the afternoons, this child goes a few minutes to a general ed class with 24, 25 children. How do we do with that? Is that good, or is it?
Well, I think everything is really based on the child. So what I would say is, what is your goal? You know what I mean? What are you trying to accomplish? Is that child able to accomplish it? I think anything that comes towards the end of the day is harder, just in general. It's harder for them. I think what happens a lot, unfortunately, is the kids are put in regular ed, but they have an aide or a paraprofessional, so they don't listen to the teacher. They listen to the paraprofessional. So now you have one-on-one teaching with 24 other kids around. That's not inclusion to me.
Right.
So I think, and then sometimes I have to motivate kids to listen to the teacher.
Yes.
Literally, I'll say, if you can tell me 3 things the teacher said, you can get 5 minutes of video time. Because now they'll listen to the teacher. So, there's a lot of dynamics at play. But I think, again, if you are including a child, that's telling me that child can listen to the teacher. A lot of the kids have processing issues, so they can't keep up. So the pace is too fast. So they don't get a lot of what's said in the classroom. It's overwhelming. There's too many kids. So you have to evaluate really what's going on for that child in the classroom. And I'm telling you, the best way to do it is ask them. We so often don't ask the kids what's wrong. Why is that a problem? And a lot of times, if they know, they'll tell you. They're not necessarily motivated to not tell you. And I'll tell kids that my job is to help make school better for them. I can't make it so they can't go. But once they believe I can do that, if you're not able to take notes, what if I got the notes for you? And then I'll call school, and that helps me develop rapport. And they're like, well, hey, can you help me out with this? And within reason, I'll help out whatever I can. But I think you have to be careful, because we always have to up the bar. Because I want them to be functional. I don't want them living in their basement. So how do I get them more functional? And it's sometimes, for the paraprofessional, it's easier just to get the kid quiet. Because now you got a teacher looking at what are you doing. And so what we have to do is push sometimes. So I'm not afraid. In my office it's different, but I push the kids a little bit. Now I try to monitor so I don't overwhelm them or upset them. But I to get the most out of them, I have to push a little bit, which means there might be a little behavior. And these kids are the most persistent kids in the world. I mean, they get gold medals because they can just go and ask and ask and ask, and they get stuck on something. So I think you have to evaluate what the purpose is. Is he overstimulated? Well, then you might have to do an hour of sensory before he goes in and does 20 minutes of math time in the regular ed. That might be variable day to day. So I try to teach them how to recognize this, so that I say, are you ready to go in? You tell me when you're ready to do what I'm asking you to do. And then. Go ahead.
That's how I feel sometimes, that child is not even tuning. That little kid's in his own little world, And
So why send him?
I know, and we're walking back to class, and I'm asked to our class, and I'm asking, what did we learn? What did we do? And he's just set on this one poster that he likes that has facial expressions in the classroom, and that's what he starts talking about.
Yeah,
And I
so,
feel like it's a
I don't know exactly what's going on, but I don't see that as being a big benefit. benefit. And I do a lot of observations like that, and I had a young man in middle school, he's in Spanish class, and she's clipping along days of the week and conjugating verbs, and he's already had two, oh, I forgot my planner. So he's out, comes back in, then he's got to go to the bathroom. So he walks out, and I said, Jason, how was Spanish? Oh, great, I love Spanish. Yeah, Spanish is great. I said, okay, what'd you learn today? And he kind of looks at me, I said, can you tell me one thing that you learned in Spanish today? No, I can't. You know, and it's like, well, so why are we in? You know, he's completely overwhelmed, he's not getting anything out of it. So what he has learned to do is adapt. No problem, I'll take care of it. I'll figure out ways to work around this Spanish class. So let's find something else we can teach him and make him more functional. So what I'm trying to do in Illinois is make programming, like in middle school and high school, like an hour to 2 block, where we only work on social skills. We only work on problem solving, only work on executive functioning. PE locker room, not a good place. I mean, you know, I got the privilege this last year, I got my daughter's PE teacher at their grade school really liked me, and she said, can you come and present to the Illinois PE Teachers State Conference? So I had 250 PE teachers, and I'm teaching them about autism. And I'm always talking about, and I said this to them, I said, how many of you in this room weren't athletes? So we've got 250 people. And 2 ladies that looked like they're about 70 years old raised their hand. And I said, what's your guys' story? And they said, well, they didn't have sports for girls when we were in school. I said, so you're actually athletic? Yeah. I said, okay, so everybody in here is athletic. I'm now going to tell you about kids that are not athletic. So you have no perspective of what I'm talking about. You don't know what it's like to get picked on in the locker room. You don't know what it's like to get picked last. So they have no perspective. So a PE teacher doesn't become a PE teacher because they're horrible in sports and they got bullied in the locker room. I think I want to go be a PE teacher. That's not how it works. They had a good experience. I think what's also hard for people to understand is a lot of people that are teaching like school. They love school. It's great. So how can they have a perspective of the students that I treat? So like my little one has a reading disability. And I can promise you one thing, if the thought of teaching comes up, and she's not had a bad experience, she just can't read like everybody else, like, no, I don't want to be a teacher. So imagine, try to have that perspective in mind. So PE, the teachers are like, oh, they'll be fine, it's just the locker room, boys will be boys. So now I got a kid that might as well have a huge bullseye on it. And the boys tend to seek out, you know, an attack and snap with a towel. The girls, just globally speaking, tend to just ignore. They just ignore the other girl. Or the guys seek them out and pick on them and turn their lock backwards and hide their gym clothes and pick them last. And, so that's not a very pleasant experience. So what I said, when I set up a program, I said I have 2 rules to do a program. Number 1, that you don't argue with me about credits. You know, I'm going to pull them from some academics so I can teach them functional skills. Number 2, I don't want to hear a word about PE. I don't want to hear it's Illinois State, blah, blah. I have an IEP kid, which is individualized. So don't give me the, you know, if I'll teach them about health, I'll give them, you know, take them to the weight room and have them work out or something, but, they, you know, who majors in dodgeball? Nobody does it for a living other than the PE teachers, so I don't. That's just, I guess we gotta stop, the lights are out.
This has been a wonderful evening. Thank you for coming. It's one of the most dramatic endings of a symposium.
It's a first for me too.
So be careful on the way home. Thank you again.
Oh, yes. Are you really?
Yeah.